Hi, I'm Matt Peterson, the Director of Rehab and Wellness Department at Mary Greeley, where we provide physical therapy, occupational therapy, and speech therapy. Thank you for choosing McFarland Clinic and Mary Greeley for your total joint replacement, whether that's a total hip or a total knee. You've made a great choice. McFarland Clinic has an excellent group of orthopedic surgeons, and Mary Greeley is an award-winning hospital. We're going to take great care of you. Today, you're going to learn a lot. We're going to use our total joint replacement guidebook as the basis for your education here, and you're going to hear from a lot of people on our team, our ACS nurses, our med-surg nurses, our case managers, and a social worker. However, the most important people on your team for total joint replacement is you and your coach. A coach is generally a loved one, family member, friend, someone who is going to go through the process with you. There's a lot to learn. Hopefully they're watching this video with you. There's a lot to learn to prepare them for the process you're going through and to help you once you get home. And it's very important for them to be well informed. You're going to learn a lot about what to expect and what you need to do before surgery, what to expect while you're in the hospital, and then what to expect after surgery. So we hope you get a lot out of this video. I'd like to talk to you now about a basic surgical overview to help you visualize and understand the surgery that you're going through. One of the goals of the surgeon is to remove the bone on bone that you've probably all heard about and reduce your pain. And doing that by reproducing the normal anatomy as closely as possible to what you had before the arthritis came on. So this is a model of a total hip replacement surgery. You can see here on the pelvis, they will go in and scour out some of the old joint socket, and they replace it with some metal and plastic. And on the femoral component, they're removing some of the arthritic bone of the ball in the neck and replacing it with an insert there. And then they will go together. Now, with total hip replacement surgery, there is a small risk of joint dislocation with it, because when they have to go in and do the surgery, they need to separate and get into the joint, do the replacement, and put in the components. And when they put it back together, they are suturing the joint capsule together. And until that joint capsule heals, which is about 6 weeks out, you do have to respect the total joint hip precautions that we'll talk about here in a little while. But that is only for about a 6-week period of time, and it's as a result of the specific surgery that you're doing to protect it. Now, the total knee, we're told by the surgeons that it is a much more stabilizing or much more stable surgery. There is not the risk for dislocation as with the hip. And I'll just demonstrate the model here a little bit and how they're cleaning up the femoral component, again getting rid of that bone on bone and replacing it with our metal and plastic in here. And there are different designs of these joint components, and your surgeon's going to select what's best for you in an effort to reproduce your anatomy. I'd like to talk to you next about preparing your home for your return. I think this is one of the most important asks of you before surgery, because the worst thing I can imagine is you go through surgery and it's all of a sudden, okay, time to go home, now what? You haven't made any plans with how to get into your home or who's going to help you. This is where that coach is very important as well. They're going to be your primary caregiver. So one of the things I like to ask people to do is do a dry run before that time, before your surgery, so that you're going home, you're going to park the car. Now what do? If you can simulate some mobility, I'd like you to try to get a walker and start practicing with a walker. But think about, how am I going to get from the car into the house? Everybody's circumstances are different. Some may just have a walk-in, nothing but a little threshold to get over. Most people are going to have some stairs. Some may have a ramp. Some may have handrails. All those things are different for everybody. I can tell you our physical therapists are going to help you after surgery while in the hospital. We're going to help you. We're going to practice walking. We're going to do some stairs practice. We're going to talk about car transfers, and we're going to cover a little bit of that a little later on in the video as well. But I do want you to learn as much as you can prior to surgery and make changes. You may want to build a ramp if you have that ability, or build handrails. Or if you learn that your stairs are kind of rickety and narrow, you might need a new set of stairs built so that you can work with us and learn how to get up with a walker. So that is the first step of this dry run, getting into the house. Then I want you to walk throughout the house and see what you can learn. Okay? You may have a lot of trip hazards that need to be removed, like throw rugs or ratty carpet or things like that. As you're walking with that walker throughout your house, you might find that dog keeps running around circles on your legs, and you're going to need to do something about that so that they're not going to cause you to trip. So you can learn a lot by practicing throughout the house. You might have narrow doorways in your toilet or in your bathroom, those types of things. So you want to learn as much as you can with mobility throughout the house and address what you need to do. You might need to take a bathroom door off the hinges and hang a curtain, for example, if your doorway is too narrow. I'd like for you also to think about where you're going to spend your days, how you're going to spend your day. You might have your favorite chair. Well, if that's a chair that really swallows you up and you have a lot of trouble getting in and out of, it's probably not the best place for you. I'd like a nice firm side chair with a good firm armrest that you can push yourself up and out of. That's the best situation. Plus, some of those chairs aren't the most comfortable, so every hour or two you're going to want to get up and go for a walk. We do not want you going home from the hospital and spending all your days in bed. You're going to get weak. You need to be sitting up, you need to be moving around to get stronger and keep your lungs clear. So think about where you're going to spend your time. If you've got that lazy boy that swallows you up, or that couch that really swallows you up, it's going to be too hard for you to get out of. So if you can practice getting up out of your favorite chair, and you can do that pretty much with one leg right now before surgery, then you might do okay getting up and down out of there after surgery. But if you're having a lot of trouble now, then it's going to be even harder after surgery. Plus, with total hips, one of your hip precautions that will go about is too much hip flexion, and if your chair is too low to get up out of, then your hips are too low, and that might be a dislocation risk for you. Again, we'll cover that here in a bit. So can you get up and down out of the chair? Can you walk freely throughout your house, into the bedroom, into the bathroom? Think about night lights and those kind of things. If you're getting up in the middle of the night, are you going to be able to see? Remove all those trip hazards. Again, therapy will help you with this in the hospital. After surgery, we'll cover a lot, but I want you to do what you can before surgery. I'd also like to talk to you a little bit about some wellness, how you can prepare your body, not just your home before surgery. I'm sure you've already heard about smoking cessation and tobacco and nicotine cessation. That's going to help oxygenate your blood and help with your recovery. We also can do the exercises that are in your book to prepare your leg strength and get you strong. The stronger you are going into surgery, the better you're going to be after surgery. Some of you may have already been started on some pre-op therapy, and that's fine. Follow the instruction of your therapist. But others of you, if not, just start doing some of those exercises. They're very simple, and we're going to touch on those later on in the video as well, but they're okay to do from a pre-op standpoint.
And now we're going to be talking about stopping or adjusting your medications. We want to make sure that you get the opportunity to discuss with your physician all of your medications before your surgery so that you know what to take before and after. This is going to include a complete list of all of the over-the-counter medications, prescription medications, any vitamins, and any herbal supplements that you might take at home. Please bring the actual medications in their original bottles to your preoperative appointment with your surgeon. These medications are not going to come to the hospital with you unless your physician specifically asks you to bring them with you on your surgery day. Your physician is going to give you instructions on stopping or adjusting your medications at this appointment. It's going to include stopping any non-steroidal anti-inflammatory types of medications. These are also commonly called NSAIDs. Examples of NSAIDs are Motrin or Advil, also called ibuprofen, and Aleve, which is also called naproxen. We're going to ask you to stop these 10 days prior to your surgery date because these types of medications can affect your blood cells called platelets, which help your body to stop bleeding by clotting. To further reduce the risk of complications, you're also going to need to stop taking any herbal supplements that you take at home. Examples of these medications would include garlic or glucosamine. Now that we have talked about stopping your medications, we're going to talk about a medication that you're going to need to add to your routine before your surgery. 2 days prior to your surgery date, we want you to start taking 1,000 milligrams of Tylenol, also called acetaminophen, every 8 hours until you go to bed. If you're already taking a medication with Tylenol in it, such as hydrocodone, we want you to keep taking that medication and not add any additional Tylenol to your routine. We want you to start taking this Tylenol 2 days prior to your surgery date because studies have shown us that it can help decrease your pain after surgery.
Now we're going to talk about packing for the hospital. There's a few items that we want to make sure that you bring. There's a couple optional items we're going to talk about, and there's a few items that we ask that you not bring. So first, let's talk about the items that we want you to bring. So that would be your identification, such as a driver's license, your most current up-to-date insurance card, and then we want you to bring your advance directives. If you have a copy, the most updated copy at McFarland or here at Mary Greeley, then you can leave that copy at home. It's just if we do not have a copy at either place or there is a change or an update that needs to happen. We also want you to bring this, your total joint replacement guide. We'll be using that while you're here. We also want you to be mindful to pack some clothing that is loose and comfortable. When you come in, you might be wearing just your regular clothes, but when you go home, you're going to have a dressing where that total joint procedure happened. And so you're going to be working with physical therapy while you're here, and we want to make sure that you're able to move well with the loose and comfortable clothing. We provide a gown for you if you're spending the night, but if you'd like to bring your own pajamas, that's okay too. We also ask that if you wear a CPAP or BiPAP machine at night, that you go ahead and bring that in with you. If you can make sure that it has your name on it, that would be great. And then make sure you bring that in with you when you arrive to the hospital. We don't necessarily want to keep it for after the procedure, so if you can keep it with you when you come in, that would be great. As for the optional items, these could be your personal care items or activities to keep you busy during any downtime. These are just for your comfort and are optional. Some examples of personal care items that people may bring are toothbrush, toothpaste, electric razor, contact case, or deodorant. We'll provide everything that you need, but if you have something specific at home that you want to bring in, then you can certainly do so. As far as any activities, you can bring a crossword puzzle book, you can bring a book, you can bring a magazine, or you can bring your cell phone. Just with your cell phone that we ask that you are considerate of others. So let's talk about a few items not to bring. That would include valuables. We don't want those to be lost while you're here. So if you can leave things such as cash, credit cards, keys, or jewelry at home, that would be great. And then also if you have any of your medications, then we want you to leave those at home because we provide those for you here at the hospital.
For your safety, you must have an empty stomach before surgery. This ensures that you do not vomit during your surgery, which could cause serious complications. Surgery may be delayed or canceled if you do not follow the eating and drinking guidelines. The eating and drinking guidelines include no solid food 8 hours before your procedure. Some physicians may accept clear liquids 2 hours prior to your arrival to the hospital. Take your medications as instructed by your physician. You may take your medications with a sip of water. We also advise no smoking or nicotine with substances, as this impairs wound healing. If you are a diabetic, you may have different eating and drinking guidelines before your procedure. Please speak with your physician if you have been diagnosed with diabetes.
Showering and bathing before surgery is one of the important things that you can do to help prevent post-operative infection. The research shows that infections come from bacteria that naturally live on our skin, and if we can reduce that, then we help to prevent those infections. You will get a kit from your doctor's office that contains 2 sponges and a soap that is called chlorhexidine. We abbreviate that as CHG. If you have an allergy to CHG, please tell your surgeon so that they can provide a substitute. We want you to have freshly laundered towels, pajamas, and things that you will sleep in, your bedding, your sheets and pillows for the night before surgery, and also clean pajamas and clean clothing to wear to the hospital the morning of surgery. When it's time to do your shower the night before surgery, wash your hair, the normal routine, whatever you normally do for your hair. Rinse thoroughly, and then get your soap ready. You will use 1 sponge the night before surgery and about half of the bottle of your soap. Lather your whole entire body, chin to toes, but avoid your genital area. We want the lather or the soap to stay on your skin for 5 minutes. So it's important to stand away from the spray of the shower so that the soap doesn't get rinsed off before the 5 minutes have passed. Pay special attention to the area of your body that is having surgery when you're lathering your soap. After 5 minutes, rinse thoroughly. Use that freshly laundered towel to dry your body. Please do not put on any lotions, creams, powders, or ointments on your skin after you have showered. It's okay to use deodorant if you wish. The other thing is, please do not shave the area of your surgery. We will do your skin prep when you come into the hospital. Another thing to think about is if you normally have pets that sleep in bed with you, it's important that they not sleep with you the night of surgery. Go to bed on clean sheets and do the exact same process the next morning before surgery. The new sponge, we're going to use a new towel. We're not going to use anything that we used the night before. The same process of lathering your body from chin to toe. Leave it on your skin for 5 minutes. Rinse thoroughly, and deodorant is okay, but no other lotions, creams, or ointments. When you're choosing clothing to wear after surgery, consider how snug your dressing might be. Loose clothing is usually more comfortable. An elastic waist is usually more convenient. And often slip-on shoes with a nice sturdy non-skid sole is a safe and comfortable option.
Today we're going to talk about your preoperative and operative journey here at Mary Greeley Medical Center for your total joint. When you arrive to the medical center, we have a beautiful entrance. Your surgeon will give you the time that you should arrive. Please arrive as close as you can to that time because we'd like to make sure that you are on schedule and make sure it all goes smoothly. As you enter the medical center, the information desk will be right in front of you. There's some very nice people there that will help you begin your registration. They'll give you a really neat pager and have you have a seat in our beautiful lobby. The registration personnel will give you a call on your pager and come get you when it's your turn to get registered. There you're going to need your driver's license and you're going to need your insurance card. That's all you need to bring to the medical center. We'll take care of everything else. From the ACS lobby, you'll be escorted to your private room here in the ambulatory care. Here we're going to get your vital signs, we're going to get you a gown, we're going to have you sign your consent for your procedure, we'll start an IV and ask you some more histories to verify your medical history. We're also going to do a little bit more prep. You took your showers last night and then again this morning before you came to surgery, but we're going to take some very nice warm wipes and wipe down the surgical area. We're also going to use, if there's no allergy, these betadine swabs. Just a gentle, right in the first about inch of your nares, we gently clean the nares to help another line of fighting infection. You'll also meet with your anesthesiologist and your surgeon here before you go to surgery. The anesthesiologist, he or she will talk to you about the side effects of anesthesia, all the risks or benefits that are there. Side effects might include maybe a dry mouth, maybe a sore throat from the tube that they put down. Pain is the #1 side effect of surgery, and they'll talk to you about different ways that they'll help you with that. Also nausea. Nausea can be, kind of a bad side effect with surgery. So visit with your anesthesiologist if you have a history. They will help you to be less nauseated, or maybe not even nauseated during your procedure. Your surgeon's also going to come in. Your surgeon's going to make sure you don't have any last-minute questions. They're going to make sure there's no more worries or concerns, and they're also going to mark your surgical site. Now you're ready for surgery. Your family will be escorted by one of the Mary Greeley employees to the surgical family waiting room. There, they will be introduced to a volunteer, and she'll keep them updated about your surgical journey, and that's where the physician will come out and visit with your family members after surgery is done. For you, if your physician has talked to you about a surgical block, if this is something that's indicated for you to help decrease post-op pain, then you'll take you to the surgical holding area that's right before the OR. We'll give you a little medication, we'll put you on monitors, we'll give you a little medication to make you more comfortable, and we can make you numb all the way down the front of your leg. Your doctor will have talked to you about this, and your anesthesiologist. Your next step is the OR room. We're going to do lots of safety checks, timeouts. We're going to make sure that everybody is all set and centered for you, and then the anesthesiologist will come in. They'll give you a little medication, make you sleepy, and out you'll go. You'll wake up in the recovery room. This is where you need to communicate with us if you're having any of those side effects of surgery. If you're having pain, please tell us. You are one-on-one with a recovery room nurse, and they can help take care of that pain. If you're having nausea, another side effect of surgery, please tell them. They have medications right there that they can put in your IV to make sure you're more comfortable after your total joint experience. When you're awake enough, we'll get you up to the medical surgical unit here at Mary Greeley. That's where you'll be spending the night as long as you need for your total joint experience. Your doctor has talked to you about that. Or maybe you'll come back to me in this private room, and we'll do a great job of education and get you all set so that you can go home the same day after your surgery.
Welcome to the post-surgical floor. Depending on your surgeon and the type of surgery you had, you may be staying in this room or going home. We're going to go over some items in your room, starting with the call light system. Each room has a call light system, and to get a hold of your nurse or your patient care tech, you will press this red button to communicate with your nurse. If for some reason you drop this at night, you can also press the red button on the side, which will also communicate with your nurse. It also helps you turn your lights on and off in the room, and it's also your TV remote control. Another item to go over is your phone in your room. This is how you will order your meals. There's a room service button. It will either be a dietary service member who will answer the phone and take your order, or a message machine. It takes about 30 to 45 minutes for your food to get up here. You can also communicate with your loved ones on this phone, or they can call you on this phone. Each room has their own number. We'll also go over your Insanis barometer. We will want you to do this 5 to 10 times every hour to prevent infection and pneumonia. After surgery, we will take your vital signs for 5 hours to make sure we're monitoring your oxygen, your blood pressure, and your temperature. And those items are over here.
Each room is equipped with a communication board. This keeps communication open about your day-to-day activities. The first section includes basic information such as the date, your name, and your room number. The second section includes information about the staff caring for you. It'll have your nurse, your patient care tech, and any ancillary staff caring for you such as physical therapy and occupational therapy. We also include the name of your physician and the duration of our shifts. The third section is all about your mobility. After surgery, we use 1 to 2 staff members to get you up and moving safely. We also help you set a priority. This is something that's important to you throughout the duration of your stay. We will also set up goals for the day, such as getting cleaned up and getting in the chair 2 to 3 times. The last section is all about your pain management. This is extremely important after surgery to make sure you're able to move at a comfortable pain level in order to work with physical therapy and occupational therapy. We'll list the pain medications that are available and when you can request them again. We also go over a pain scale with you quite frequently. We'll ask you to rate your pain on a scale of 0 to 10, 0 being no pain and 10 being the worst pain. We also include an M in the box here. This is saying to anyone that enters the room that you're on a new medication and we should be doing lots of education. Pain control is very important when it comes to therapy. On their daily schedule board, we'll include physical therapy and occupational therapy times. You're going to want to take pain medication 30 to 45 minutes prior to your appointments.
It is our goal after surgery to get you up the same day with either physical therapy, occupational therapy, or your nursing staff. It is important to make a pain management plan with your nurse to help manage your pain and set you up for success for these activities. Another thing is we want you to have small, frequent meals throughout the day to prevent nausea and promote nutrition. You will also have an IV site that will help keep you hydrated and that we will keep in the whole time during your stay in case of emergencies. Depending on the surgery you had, you might have a Foley catheter device. This is a drain that helps drain your bladder of urine. We will try to get that out as soon as possible to promote ambulation and prevent infection.
Fall prevention and safety is a priority after surgery. We use a variety of tools to ensure your safety. The first tool is your call light. Each room is equipped with a call light and we'll make sure that this is within reach before we leave the room. If you can't reach your call light, there's a call light here on the bed. It's shaped like a red cross. This will also be effective in calling for help. The next tool we use is called a gait belt. We use the gait belt anytime we're getting someone up in order to have something to hold on to and steady them if they become unsteady. The next thing we'll use is alarms. Anytime you're a fall risk, we'll have alarms on your chair and your bed. The fall risk assessment is done each shift and can vary from shift to shift based on how you're moving and the medications you're taking. We will also put this yellow band on your wrist if you do qualify as a fall risk. This signifies to anyone that you're at risk for falling if you're walking in the hallway or if they come into your room. You'll also have a pair of grippy socks that increase the amount of traction when you're getting up and walking around. The other thing that we want to prevent after surgery is blood clots. It's very important that you get up within a decent time after surgery. Oftentimes we'll get you up on the same day of surgery between PT, OT, and our nursing staff. The other thing that we'll put on you is leg pumps. These will intermittently put pressure on your calves in order to keep the blood flowing and prevent it from clotting in your legs. If you don't have the leg pumps, you may have TED stockings, which are tight white socks that put compression on your legs. The other thing we do encourage is ankle pumps. You'll also be taking a medication called a blood thinner. You'll either be getting an injection or a pill form.
If your plan is to go home from surgery, make sure you have plenty of support to help you. Also, make sure your outpatient physical therapy is arranged ahead of time. This will help make sure that you get the time and location that works best for you. Therapy will be 2 to 3 times a week, so make sure you have a ride available to take you to those appointments.
Different discharge options may include going home with outpatient therapy, home health, or going to a skilled or rehab facility.
While you're in the hospital, a nurse care coordinator will meet with you and go over infection prevention and home cares.
Most patients will be able to discharge home directly from the hospital, but some may need a short-term stay at a skilled nursing facility. A skilled nursing facility is a short-term rehab that provides 5-day-a-week physical therapy.
Once you go home, you want to report any redness, swelling, drainage, or uncontrolled pain to your surgeon. Some swelling is normal and expected, but if it does not improve with elevation and ice, report it to your provider because it could be a sign of a more serious complication. To help prevent infections, keep pets away from the incision and have good hand hygiene.
If you feel you may need a skilled nursing facility, do research before you have surgery. Know what insurance benefits are and who is in network with your policy. Planning will help speed up the process and will help get your top choice of facility.
The dressing that is placed prior to discharge is water resistant, so make sure you're showering regularly.
If you have any questions about the discharge planning process, contact your provider and they can get you in contact with a social worker or a nurse care coordinator.
Now I'd like to talk to you about your return to mobility and what to expect after your surgery. Kind of go over a little bit of a timeline. But before I do that, I want to speak directly to the total hip patients. Mentioned that there were hip precautions after surgery because of needing time for that joint capsule to heal up and really stabilize and secure the hip joint. Again, that's about 6 weeks and your risk is minimal, but it is something that needs to be respected. There are 3 movements primarily that we want you to avoid. One is a hip flexion activity beyond 90 degrees. And if I can demonstrate that here, so you can see about 90 degrees here. Now, I don't think many of you are going to pull that knee up, stand on one leg and pull that knee up beyond 90 degrees, but that 90 degrees is important when you might be bending forward, getting dressed or leaning forward. You can see that hip angle here. So if you drop something on the floor, you'll have to be careful, and we'll talk about that. But avoiding flexion beyond 90 degrees, and that also comes into play when you're sitting maybe on a low chair. The lower the chair, the more hip flexion you have. So we want to elevate the chairs when needed. Elevated toilet seat is also beneficial, and we'll talk about a few more of those hints coming up and while you're in the hospital. The next movement is hip internal rotation that we want to avoid. That comes into play the most part if I'm a right hip surgery, if I twist to the right, you can see that causes my right leg to rotate internally. So I want to avoid doing a lot of that. What's easy to remember with this, if I'm in the kitchen reaching or twisting where I might do that, just keep your toes pointing straight ahead to wherever the action is, whatever you're doing. Keep the toes straight ahead. That minimizes any hip rotation with that. The third motion to avoid third hip precaution is crossing the midline with your surgical leg. You have to be careful with this, maybe laying on your side in bed or getting in and out of the bed or the car. If you're turning your upper body too fast and that leg kind of lags behind. Again, we'll practice a lot of these movements with you in the hospital, talk a little bit about it too later on, okay? But those are the 3 hip precautions until that joint capsule is healed up solid. Those 3 motions, if we limit those, we're protecting that and avoiding any injuries. Now I'd like to talk to you about what to expect as far as return to your normal activity and normal mobility. Early on in the hospital, obviously you're going to be recovering from the surgery and the anesthesia. You're going to be having some pain, which is perfectly normal after a surgery, and getting used to your pain meds. And then physical therapy is going to come into your room and ask you to get up and get moving. At that time, I hope you can remember one thing, that movement is very helpful in your post-op recovery. So while you may not feel like moving at that time, and we will see you the day of surgery in most of the time, it is beneficial for you to get up with therapy, and if not, getting up with the nurses if you are later in the day. But getting up, doing some weight bearing, and doing some movement is very important initially. So remember that when we come into your room. But after that, as you return to normal activity, there are lots of equipment, pieces of equipment that I'd like for you to consider purchasing ahead of time. You can get these at local pharmacies, local big box stores. You can get them online. There's a list of those in the back of your booklet as well. I can show you a demonstration here. This is a long-handled sponge which helps with bathing. There's a reacher and a grabber that helps with dressing and anything throughout the house that you drop if you're not going to be able to get down and get it. It's a very versatile piece of equipment as well. Long-handled shoe horn to help get those pesky shoes on. And this is a fun tool called a sock aid, where you can put a sock on this and then dangle it down, and you can actually slide your foot into it and you pull it up the back of the thigh using the ropes. It's called a sock aid. It doesn't work perfectly, it doesn't get them all the way up, but it is something that's helpful. It's not as good as that helpful coach, loved one that you have with you. Those are the best sock aids, but if you need to have a little higher level of independence, the sock aid in that equipment will be helpful. Again, after surgery, therapy is going to come and help you with walking and getting stronger and practicing stairs, and talk to you about getting in and out of a car. Our occupational therapists are going to come in either the day of or the day after surgery to help you with dressing and self-care and help you use these tools and identify what tools might work best for you, but to help you get ready to go home and take care of yourself. Many of you are going to go home day one after surgery. Some of you may go home the day of surgery, and we expect to be doing more and more of that. However, we're not going to kick you out of the hospital before you're ready. We're going to take care of you. Under some circumstances, you might stay till day 2 or day 3 until you're feeling well enough to get going home, but the majority of you will be going home day 1, if not sooner. I'd also like to talk to you about the walker. This walker is a two-wheeled, front-wheeled walker with gliders on the back. I prefer this. You can also use just a no-wheeled walker, a standard frame walker. Those work just fine. They're very stable. You're not going to be burning up the streets after surgery anyway. But let me just demonstrate to you how to walk with a walker. And this walker is actually a little too low for me, so excuse that. Ideally, the walker height is right at about your wristwatch height. So I'd say this is about 3 inches too low for me. Okay? But for walking, we're going to pretend it's a right hip surgery, and you're going to slide the walker forward, stepping forward with the surgical leg, placing the weight down through the hands. Now you are going to be, hips and knees are going to be both weight bearing as tolerated. So you can put as much weight on that leg. It will not hurt you. It will not do damage. It may be a little uncomfortable for a little while, but it's not going to be an issue. So walker, surgical leg, weight down through the hands, stepping forward with the non-surgical leg. Moving the walker, surgical leg, weight through the hands, okay? It is normal for all hips and knees to maybe need a walker for about 2 weeks. That walker could be standard walker, a two-wheeled walker. The only thing you have is a four-wheeled walker, that is fine. If it's got a bench and a horn, that's great. But my preference might be a two-wheel walker, because sometimes those four-wheel walkers aren't quite stable enough. No-wheeled walker, a standard walker, is fine as well. You're not going to be moving too fast with that. You're going to need that for about 2 weeks, I tell people. Again, this is an average range of that. From progression to the walker, you're going to go to a progression of a cane. Okay? Again, the cane height is about the same as the walker, and we use that on the opposite side of your surgical leg. Again, that's a progression that your therapist might be able to help you with after surgery about 2 weeks out. Sometimes that's 3 weeks or 4 weeks, sometimes it's 1 week. There's a wide range of variability in the recovery of it. For the first week or two, for the first few days after surgery, it is going to be a challenge for you to get out of the house and just to get to your therapy sessions. I should say that Total Knees are going to begin surgery Total Knees are going to begin therapy as close to surgery as possible on discharge. So, if you're going home on day 1, it's okay to start therapy on day 2 or day 3 for a total knee. Total hips are not going to start initially right away with therapy. That decision is made currently about 2 weeks when you recheck with your physician. If you feel like you need therapy, you can discuss it at your 2-week recheck. So initially when you go home from the hospital, the hips are just going to do the exercises that you're going to practice pre-op, learn and get reinforced in the hospital, and doing a lot of walking. Total Knees, you're going to do the same, but you'll also be going to therapy after surgery. You're going to probably need that walker for about 2 weeks and transition to a cane. And getting in and out of the house for the first week or 2 is going to be a lot of work. And if I can just share my general expectations with you, about 2 weeks to 4 weeks, maybe leaving the house becomes less of a hassle. Maybe taking short trips in the community out to eat and things like that will become more realistic at around 2 to 4 weeks. And then around 4 to 6 to 8 weeks, it might start to become, there's a good gradual progression back to normal. You can go to church, maybe go shopping a little longer, and getting out is going to be less of a hassle. And somewhere around 2 to 3 months, you're probably got all your normal mobility back for the most part. Maybe the high level stuff is limited, and hopefully around 6 months or a year, you might forget you had surgery, and it's going real well. Knees can be swollen and hips can stay swollen for several months after surgery. That is normal. It doesn't need to be alarming, but that can be a prolonged swelling. But as long as you're functioning fine with good strength and good range of motion, that's nothing to worry about. I'd also like for you to consider getting a good ice pack at home. For the hips and the knees, ice is a very good pain relieving modality. It's also a very good inflammation, edema reducer, and again will help with that pain and improve your mobility as well. Keeping a good ice pack on there, getting the skin good and cold. Don't frostbite it, but we want it good and cold to the touch for about 10 or 15 minutes several times a day after you go home. At some point before you go home from the hospital, therapists will not only come and walk with you, but many times we're going to take you to our therapy gym. In our therapy gym, we have a car simulator where we're going to help you with the car transfer to allow you to get home safely. We also have stairs in that gym that we will practice on and talk to you and navigate and help you do the stairs just to make sure you're safe to go home. We also have a simulator for a bathtub and an example of a bath bench to help with that transition. Again, our occupational therapists and our physical therapists will all help you with the education that you need. There's excellent material and information in your book as well. The exercises are a very important piece of your post-op recovery. However, you can get some benefit out of those exercises by starting with those pre-operatively. Your book does a great job of outlining several simple exercises and a few more advanced exercises. For pre-op, it is okay for you to start doing all of those exercises. I encourage you to work the muscles and get as strong as possible, and it's good practice. But the better shape you are going into the surgery, the better recovery you're going to do. My therapists tell me in the hospital they can tell the people who have worked hard pre-operatively and done the exercises. So that will pay off for you. As you go through the book, there's several simple exercises from ankle pumps to gluteal squeezes to heel slides, lots of different ones. I'm going to highlight just a couple exercises for you that are very important post-operatively, and I think there's the biggest bang for your buck pre-operatively. But again, I encourage you to do them all. The quad set exercises. which is where you're sitting up or laying down and you're squeezing your thigh muscle on the top of your thigh. It'll lock your knee straight and you're trying to make that muscle real tight and firm on the top of your thigh. The next exercise is the straight leg raise. So trying to raise a straight leg raise from that position. Too many times I see people just think it's a leg raise, it's not a straight leg raise. So that straight leg raise is very important to lock that knee straight. So do the quad set, get good at that, and then lock it real straight, and then raise that leg while holding that quad set. So that will maximize this quad strength and one of the best preoperative exercises for you. That will be very difficult for you to do immediately post-op because of the surgery, but over the next few days that will come back, and the stronger you are again before surgery, the better your recovery will be afterwards. But maximizing that quad strength is a great goal. In closing, I'd like to ask you to make sure you're spending a lot of time with your total joint replacement guide. I want you to make sure you're reading through there. There is a lot of information that wasn't covered specifically today in our video, but it is very important and it might help you out further. Mary Greeley has a great outpatient therapy program. Whether it's physical therapy, occupational therapy, or speech therapy, we have expert therapists who will develop an individualized plan of care for you and meet your needs. I hope you learned a lot today, and we'll see you soon.